Good morning, everyone. I am Dr. Richard Logger. It is my privilege to lead you through a project that is very close to my heart, the Mobile Health Screening Initiative. As nurses, we often wait for the patients to come to us in the hospital, but by then, the window for prevention has often closed. This initiative is about flipping that script. As co-chair of the Philippine Nurses Association here in Maryland, members of the committee, I've seen firsthand that our greatest strength isn't just our clinical skill, it's our legacy of service. This presentation isn't just about the program, it's about how we are taking that Filipino nursing legacy out of the wards and directly onto the streets. We are meeting our community where they live, work, and pray to ensure that quality healthcare isn't a destination they have to reach, but a resource that finds them. Let's look at how we're putting this legacy into action. Now, let's move into the heart of why we are here. My strategic priority for this initiative is clear: the Filipino nursing legacy in action. When I look at the healthcare landscape for the Filipino diaspora here in Maryland, I saw more than just medical needs. I saw hidden barriers. I'm talking about language nuances and transportation gaps that prevent our people from seeking the care they deserve. This project was specifically selected to rectify those disparities. To ensure this initiative is both effective and sustainable, I've utilized the SOAR framework to align our goals. Our strengths are our greatest asset. We are leveraging a vast network of bilingual Filipino nursing professionals. We aren't just providers, we are cultural insiders who speak the language of the community. And the opportunity is in the partnership. By collaborating with local health systems, we can provide no cost screenings that remove the financial burden from the patient. Our aspiration is a screening journey. I don't want this to be a one time event. My vision is a sustainable, peer-led journey where we walk alongside our patients from screening to lifestyle adjustment. The result is precision. We are moving toward improved health outcomes by using standardized, Asian-specific protocols that respect our unique genetic and cultural backgrounds. Why is this urgent? Because we are fighting silent symptoms in the Southeast Asian immigrant population. Conditions like hypertension and type 2 diabetes often go undetected until there is a crisis point. We aren't just providing service, we are stepping into this to save lives before the symptoms even speak. As we move from the strategic foundation to the purpose of the project, I want to be very clear about our why. Every project needs a heartbeat, and ours is defined by clear metrics and a deep alignment with our professional values. First, I have established high bar SMART objectives. We aren't just aiming for general outreach. We have a concrete target to screen 500 unique participants and recruit a dedicated force of 20 nursing volunteers in our first year. This ensures you have the scale to make a statistical difference and the manpower to sustain it. But the benefits and impact go deeper than a spreadsheet. This project creates a triple win ecosystem. Number one, it improves the health agency of our underserved community members. Two, it provides professional actualization for our nursing volunteers, allowing them to lead outside the clinical setting. Third, and it drives institutional growth for the PNAA chapter, cementing our reputation as a community leader. Everything you see here is a direct reflection of our mission. vision, and values. I have mapped this project specifically to the core pillars of health equity, excellence, and advocacy. We are aligning local actions with a world-class vision for nursing practice. Finally, I want to draw your attention to the consequences of inaction. This is what keeps me up at night. Without this link, without us stepping into the gap, our community members face what I call diagnostic invisibility. If we don't go to them, they remain unseen by the healthcare system, leading to continued systemic neglect. This project is the bridge that ends that invisibility. As we discuss the significance of the project, we must address what I call the access trust gap in our Maryland immigrant communities. Healthcare isn't just about physical proximity, it's about cultural concordance. By having providers and patients share a common language and background, we will pass the linguistic barriers that often lead to diagnostic invisibility. This initiative is fundamentally about building trust equity. The primary impact here is the decentralization of healthcare. We are shifting the paradigm from reactive to proactive by moving services out of sterile clinics and into community hotspots. This empowers participants to take agency over their own health, which we expect will lead to a measurable increase in early detection for chronic pathologies like hypertension and type 2 diabetes. We have projected the benefits across three specific domains. Clinically, we're using Asian-specific thresholds such as lower BMI risk markers to identify silent symptoms early. Economically, we're reducing future emergency room reliance by facilitating warm handoffs through primary care clinics before health issues escalate into acute crisis. Professionally, we are creating a gold standard operational manual that can be scaled nationally across other PNAA chapters. Ultimately, this project is worthwhile because it is a transformative socio-clinical model. It doesn't just treat symptoms, it claims the health agency of the participant and serves as the vehicle for the professional actualization of Filipino nurses. If this gap remains unaddressed, our community faces continued systemic neglect and a cycle of healthcare disparities that will only become more life-threatening and costly over time. We are here to break that cycle. Transitioning into the operational heart of the initiative, let's discuss our scope and timeline. This is where my vision meets the logistical reality of Maryland region. Our primary goal is to bridge the access trust gap by achieving measurable improvements in health literacy and early diagnostic rates among Filipino Americans and immigrants population. Specifically, we are targeting 500 unique participants and establishing a sustainable core of 20 volunteer nurses. We are setting this project within high-density immigrant hotspots, specifically in Montgomery and Prince George counties, utilizing accessible environments like Filipino grocery stores, church halls, and cultural festivals where our community already gathers. The project follows a rigorous 12-month implementation roadmap. This covers the entire life cycle, from initial mobilization and foundation setting to final evaluation and the creation of a national scalability manual. Within this scope, we are looking for four key outcomes. First is the clinical, increased detection of hypertension and type 2 diabetes. For the operational, a finalized PNAA gold standard manual. For the relational, strengthen trust between the Filipino nursing community and local health infrastructure. And finally, the social, a definitive reduction in diagnostic invisibility. To be clear about what this project includes, we are providing core screenings, blood pressure, glucose, and BMI, legacy counseling, and warm handoffs to primary care clinics. We're also instituting a legacy pairing mentorship system where seasoned nurses mentor younger professionals during outreach. However, to maintain clinical and legal safety, it is equally important to define our out-of-scope boundaries. We focus on screening and referral, not long-term chronic disease management. We do not provide prescriptions or medical diagnosis. Participants are referred to physicians for formal diagnosis. Our diagnostics are strictly non-invasive, such as finger-stick glucose rather than full venous blood draws. Finally, while screenings are no cost, we do not provide direct financial aid for medical treatments or medications. By clearly defining these boundaries, we ensure that our volunteers can practice with autonomy while focusing their energy where it has the highest community impact.